the bank holiday weekend and sort of preparations, and we had a really good response in terms of some of the messaging that you and other organisations were able to help get out around that. We were also talking quite a lot about young people and that sort of growing sense of the issues faced by young people, and also I think a kind of real shared concern as well about not scapegoating young people and, you know, seeing the positive and really, you know, trying to make sure some of those good messages around young people were fed into the system. And that got fed into, there was a visit to Leeds from the Cabinet Office, sort of on behalf of Number 10, and there's a report actually, which we can share with the notes afterwards, which talks a bit about that sort of overview sense that they got of Leeds, but really helpful to see them valuing the role of the third sector. There's a particular statement around how the third sector's responded really successfully and innovatively to COVID, and greater resourcing of this sector could provide the resilience to meet the challenge of balancing simultaneous winter crisis, help address the long-term health inequalities, mental health and social cohesion in closer partnership with business. So really great to kind of get that recognition kind of going directly into central government around some of the work that we've all been doing. There were also themes around mental health, as there always is, issues around returning to services, which have been picked up and fed into a range of different meetings, and also around travel and kind of thinking of those implications. So quite a lot of different issues as ever raised by youth from the different areas and communities of interest. We also had particular presentations. So Simon came to talk about the police conduct authority, and there's a real strong link, sorry Sam, his name was, a real kind of open invitation to engage with him. I think there were some suggestions around places and other organisations that he could link with, including I know Catch was mentioned, and making sure that he was getting about taking that presentation directly to organisations. And also a sense that it would be really helpful to have some of the definite stats about how long some of the kind of complaints and reviews that he was supporting people to take forward took, that would be helpful. So I think it was a helpful conversation from his point of view, and just a reminder that if people want to pick up that conversation around police conduct, that's a real kind of open door from him. And then we had really interesting discussion around physical activity. So Active Leeds and Street Games came and were talking about the different opportunities to engage and resources that are available for people. And again, another really important area to keep on the agenda is about that sort of wider health and well-being, and making sure that people are keeping fit and engaging, particularly where we've got messages around not doing all of the social, you know, there's all of that sort of big national issue, isn't there, around the rule of six, but actually opportunities to link around physical activity and things that are kind of keeping people healthy and well is more important than ever. So yeah, that's just a bit of a quick recap about some of the things from last time, and I'll hand over to Daisy to give a bit of an overview of the weekly email that's gone out, that went, I think, last night or this morning. Hi, Daisy.
Hello, it did, yeah, yeah, it's quite jam-packed, so sorry for the overload of information, but we felt there was loads that was important, so hopefully you've all had it and had a chance to have a look. Yeah, there's lots of COVID-related information. I mean, as we said in the note, that we're aware that it's becoming increasingly complex, and there's so many different messages, you know, as there has been for a while, but we're going to be working with public health to try to simplify those, and obviously today I'm sure lots of them will come up in our discussions. But the first item was around the Test and Trace app, which launches next week. So Leeds City Council has been encouraging everybody to get ready for that, so there's some guidance on downloading a QR code for businesses or community organisations that have a physical location, so it doesn't obviously apply to everyone, but hopefully that's useful. There's a note on access to testing, so again, obviously aware there's some issues with people accessing and being able to book tests, but there's some advice there on especially for key workers and their families, which obviously affects a lot of the people that you work with. There's a new centre that's been set up on Chapeltown Road specifically for key workers, so there's some information there. There's the new Hands Face Space campaign, which I'm sure lots of you or most of you will have seen, that urges people with those 3 sort of key messages, and there are some assets and communication materials there that can be downloaded to help to spread that message. And finally, there's a session that the NHS in Leeds is running on Facebook in a couple of weeks that's really aims to tackle myths and misinformation around coronavirus. So hopefully it sounds like a useful one. So that's going to be live on the Facebook page with a number of speakers and professionals. And that was most of it. Yeah, I'll stop there.
Thank you, Daisy. Has anybody got any particular questions about any of that information before we go around and do the introductions? Obviously, you can pick them up in when it's time to speak as well. But yeah, no particular thoughts. Sorry, I need to keep an eye on the chat as well, don't I? So yeah, let's go around. I'll do it in the order that people are on my screen, if that's okay. So Anne from Volunteer Action Leeds, hi, would you like to go first?
Morning, Anne Crossland from Young Lives Leeds. As Pip's already alluded to, Young Lives together with Forum Central, we hosted a meeting of a group of providers of services to young people, as well as the community hubs that have been set up across the city, to really get their views on how we could improve the messaging to young people, what could be done differently. And we came up with quite a long list of things that have been forwarded to public health, and Mark and myself are meeting with Tim Taylor, but I think there's other work that's starting to look at different areas across the city about how we roll this information out. And that included using young people themselves to be community champions and things. In terms of Young Lives, we had the meeting yesterday, and one of the concerns from people is how they will deal with the influx of referrals that they know are probably going to start happening. Now schools are back and things, uncovering some of the safeguarding issues and safeguarding concerns. Now children are back in school, and we held a meeting with Jasvinda, who is the independent chair of the LSCP, and sort of highlighted some of those, and there will be working groups which we will be included in. And then I think one of the concerns yesterday was around funding. People are quite, they have short-term funding and emergency pots, but it's the medium to long term, and what will that look like? So I think those are the key things from Young Lives, Pip.
Thank you. That's brilliant. No, thanks. Jane, would you like to go next? Jane McDonnell, hi. Welcome to your first meeting.
Hi, Pip. Thank you very much for having me. So I'm currently doing a Master's in Advanced Integrative Health and Social Care. And I spoke to Carl the other day and wanting to get more involved and see what was actually going on in Leeds and how it progresses with its healthcare, especially during the pandemic, and that I was actively involved with healthcare itself. I previously, well, I'm still enrolled under Health Watch, but obviously during the pandemic itself, it's been difficult to integrate back into certain parts of healthcare because everyone's obviously working from home. There's not as much going on. I think the biggest thing that I've noticed since, like, especially during the pandemic, is the track and trace system and how people are actually implementing it. So when I've been out, and I've been out to restaurants, cafes, I find that if I'm on my own, I don't get asked to fill out a track and trace at all because I'm registered blind. So rather than offer to help me do it, so I feel like there's a huge part of the community, whether deaf, blind, or have severe learning disabilities, are going to be left out of the track and trace, which is missing a huge part of the population in Leeds.
That's a really good point. Thank you, Jane. Caris, do you want to come next from the Society for Deaf and Blind? And I know you're picking up a number of those issues.
Hi, morning everyone. I'm Caris Green from Leeds Society for Deaf and Blind. I think my sort of first point was around communication, which I know has been mentioned, but I think sort of linking into that point with Jane, there's a lot of changes, but there's a lot of disparity in people's understanding and how those messages are sort of being shared and people's kind of accessibility to that. One of the things that seems to be happening is people are going one of two ways. They're either kind of ploughing along and going out and about, or actually some people are now sort of shutting back down again, where we've got sort of members of the community where they started to come back out, and since cases have been rising in Leeds and there is a bit of uncertainty, they're now just kind of shut back in the homes again and sort of a little bit apprehensive about what to do. So we're kind of dealing with that by staying at home again. So I think that's one of the things that we've sort of seen. I know, for example, 2 of our trustees were kind of meeting regularly, 2 of our blind trustees were meeting regularly and seeing each other. They've now stopped that again and are staying in their own homes because they're fearful of this sort of circumstances at the moment. I think there's also been apprehension around people returning back to services, back to schools, what that means, and so we've kind of heard that from both sides really. Some of the practitioners that are going back out there are apprehensive because they've not done it, they've been off through summer or furlough or whatever. And I think one of the other things is that particularly for the deaf community, there's a very strong sort of need for that face-to-face interaction, and we tonight have got our first trustee meeting since they started in March, actually, because we've got varying degrees of people being able to access online, etc. And we're having a hybrid meeting tomorrow evening. I don't know how it'll go, but it's our first one. So we've actually got a lot of people meeting face to face who've requested, well, I say a lot, there's 6, it's not a huge amount. But we've got people from the deaf community that have asked to attend in person. So we've got them and an interpreter in person at the centre. We're then projecting those that can access online through the video screen, and we're kind of doing a bit of a hybrid. We've got some people coming purely on audio. But I think the very strong message, certainly from a lot of the members of the deaf community, is that they really want that face-to-face interaction. And that's kind of a clear message. We've seen more sort of, I think since the start of September, some of the younger members of the community are starting to sort of come and get involved in things again, albeit it's very, very small. You know, our social kind of committees and groups are still not meeting together. And I think there still seems to be a sense of when this is finished, we'll all come back together in big groups. And I think it's how we solve that problem of actually it might not happen that way. We might not have a fix in a couple of months where everybody can come back face to face. And I know Hannah's going to talk about the GP's practices shortly, but again, we're finding a lot of people that are contacting us for interpreting are saying, I don't want to do a video, I want to sit with the GP, I want to be there face to face. And in some cases, I think that is possible, in others, not as much. We're working with the Teaching Hospital Trust at the moment to start a pilot on their video consultation system, because that hasn't been used by our members at this point, but we're going to be starting to introduce that over the next couple of weeks. So an alternative in the circumstances, really. And I think that's everything I've got on my list. Sorry.
Oh, we can't hear you, Pip. No. No, I can't hear you. How weird. Go for it, Carl. I think Ali was going to go next, Carl, just because she's got to leave at 10.
Great. Yeah, go for it, Ali.
Hi, I'm Ali from Leeds Older People's Forum. In terms of older people, it's a really tricky time for older people's organisations, including the neighbourhood networks. They were just beginning to transition to do more socially distanced work. You know, for example, have small socially distanced cafes. And now, because of the rule of 6 and the rise in the R rate, things are very, very up and down. So it's literally sort of taking it not week by week, pretty much day by day, really. But because of that, then there are other pressures. So there's a real imperative to support older people to have access to digital, particularly over the autumn and winter months. There's a recognition that that's not right for all older people, and not all older people want to do that. But the evidence does show that where older people have access to digital and they can choose how and why they want to access it, that can make a real difference and can impact on the effects of social isolation, preventing loneliness. Care homes are starting to close. At least 15 care homes in Leeds have now closed because of the rise in the infection rate. And that means that older people are becoming more isolated, relatives can't visit. And one of the issues for relatives and older people is that the staff time required to take away to support older people during those visits. So there's a real pressure there on older people and their relatives as well. There's an issue around for some older people across Leeds around access to food. And Rachel Brighton and her team in public health are doing some work around that. And we actually have got some money that is going to be used to support food clubs for older people who don't have or are struggling to pay for food. There will be a very small charge for that, but that will be available. I don't know when, but I think they're working on it at the moment. I think they're just selecting neighbourhood networks who have available space and kitchens, and people can get there within a 15-minute walk. And the other biggie, of course, is the impact of ongoing social isolation, particularly as shielding is now coming back into the picture. And that could then lead to loneliness. So there's a real issue there, and neighbourhood networks certainly are looking at ways of alleviating that over the autumn and winter months. Yeah. So I'll have hopefully more of an update next time, because it's very much a moving picture at the moment.
That's really helpful, and some really interesting different initiatives there. Thank you, Ali, for that. Gina, would you like to go next from Bevan? Welcome. Hi.
Good morning, everybody. I'm Gina Rollins from Bevan Healthcare CIC. We provide primary care and street medicine to the homeless, asylum seekers and refugees and other vulnerable groups in the city. It's been a really tricky time, obviously, since March for us, particularly with the homeless. But, you know, there was a fantastic initiative in Leeds, as there was across the country, but particularly in Leeds, of getting everyone in. So our service users were placed in various hotels and accommodation that was made available. There are still some in the hotels, particularly at the Britannia up at Seacroft at the moment, which is good, but over 100 have actually been placed in accommodation with support networks around them, so that's excellent. We're obviously really concerned about the R rate rising in Leeds, as we have in Bradford. Bradford is much higher, so we've continued to do our work, but it hasn't stopped us seeing patients face to face. I know that other colleagues on this call, you know, are expressing problems of their client group being seen, but we've continued to see people telephone calls face to face in the practice, or out on street health with the bus as well. We have had access for a while to COVID testing for the homeless, so we've been able to test people out on the street or wherever they are at the moment, or even if they're moving from the hotels into accommodation, we've been able to do that, which has been really good. And there hasn't actually been that many people across the country that are homeless that are actually positive for COVID. Even our colleagues in Edinburgh have said this, and some colleagues in London. I think it's probably because our particular cohort don't mix with the general population as such. You know, they keep to their own smaller communities, shall we say. The other thing that we're doing at the moment is we're really working hard on our winter planning for health care for our particular cohort. And that just doesn't include healthcare, that includes everything that goes with it around food, clothing, isolation, social support. And of course, at the end of this month, we're just waiting for the delivery for the flu vaccine. And this year, the uptake will be different. Everybody over 50 will be offered a flu vaccine as from November. So we will be on it and vaccinating as many people as we can. So yeah, busy times and lots going on like everybody else, but please, at Bevan, we're always happy to support our other communities and colleagues in Leeds, particularly around networking or access into general practice. I know Hannah's going to talk about that, but that's a big thing for us as well, about the barriers faced by some communities into primary care. So yeah, that's where we're at. Thank you.
Thank you, Gina. Really helpful to get that kind of insight and that overview around some of the homeless work and that generous offer. I think that kind of always stands in this group, that people are kind of willing and supportive of each other and making those connections. I think it's been really helpful. Thank you. Damien, would you like to go next? We should make a little announcement here. I don't know how official we can kind of say all of this, but we've been successful as a partnership. Leeds Older People's Forum have led some work to secure some funding from the lottery around Men's Health Network, which, you know, we know has been a lack, hasn't it, in the city in terms of that. So really brilliant that working in partnership with a range of other people, including Orion Partnership and Barker and other people, just to have that sort of additional resource. So that kind of is really good, given just what a massive need there is. So welcome, Damien, and you might want to say a little bit more about that.
Yeah, thanks, Pip. Yeah, so we found out just a couple of days ago, actually. So it's new news. And as Pip said, it's for a sort of men's health network across the city, and it's about coordinating the men's work across the city, and the different partners within that have got different strands they'll be working on, you know, with their own sort of standalone projects, but that fitted in. So we've got things like Barker have got a load of tablets for men, which will be loaded up with health and wellbeing apps. That you know, and also use those tablets with those men for them to access that information and support, but wider support as well, and use these for monitoring and finding out off the men what it is, what their issues are, what they need, and what they want. We've got groups as well. We've got a bit of a weighting towards BAME men's groups as well, and we're going to be continuing with the Ambassador project as well, which some of you might know, is about supporting businesses in the local community to support their regular male customers and point them into the direction of support. Okay, so for my enclave in the east of Leeds, I suppose I'm helping to run an Ambassador project, and that's still going on now. So moving on to what's happening now. Yeah, like everyone, you know, the rise in the R rate and things we're changing our plans like just about every meeting. I'm sure you guys are the same. You have to be very nimble-footed, don't you? We're getting ready to go out and recruit even more businesses into the project, and now we're having to be a little bit more reticent about, you know, the amount of businesses we are going out and visiting, just for our staff's health and safety. And as we said, a lot of the local the people in the area aren't necessarily following the guidelines as well, so you have to be wary of that as well, the increased risk of infection there. Like others, we're trying to get out more, you know, really trying to get out there. We have got some, aside from the men's work with Feel Good Factor, I know that we are we are starting to set up more in-person projects. Like I've got a lovely Tai Chi session in the garden and things. In terms of men's work, yes, the men's group are getting to meet a little bit outside, but a lot of it is still, as you can imagine, online. And that these men are also saying that they're missing, you know, it's the two-dimensional thing of Zoom isn't quite fulfilling them. It's not, you know, it's not nourishing them, if you like, as much as they need it to. What else I know? But we're still catching up from things like phone calls and things like this as well. And there was something else I was going to mention. Oh, and it probably came out a few weeks ago, actually, but there is a paper that Professor White has released about the biological effect of COVID upon men, and looking into the reasons why there are more men dying than women. Yes, social. Some of it is social, but there's an interesting thing about. Now, this is why I showed I'm definitely not a scientist, so I'm going to try and sound like I know what I'm talking about here. Okay, just for a second. So basically, there's there's the ACE2 chromosome that we all have, and if you the ACE2 the ACE2 something that we have. Okay, so men have one X chromosome, and women have two, which means that women have two. Females have two of these ACE2 receptors, which means that the virus, it needs to unlock the ACE2 receptor in order to get into your body. Once it's done that, it can get in your body and start attacking your body. So women have got twice the defense against this. It has to unlock two ACE2 chromosomes against the male's one. Okay, and age has something to do with that. It's not just gender. There are other factors as well. But I just thought I'd give you a bit of, I suppose, scientific information there to back up some of the more social angles we're coming at this issue with. Okay, so yeah, that's me. Thanks, Pip.
That's really helpful, and yeah, no, thanks for that science interlude. We'll come back on that, I'm sure. But obviously, it isn't just about people who get ill. There's so many other implications and ways in which people are impacted. But really important to acknowledge that as well. Thank you, and yeah, really well done, all of you, on that Men's Health Network. Annette, would you like to go next? Hi.
Hi, yeah, hi everyone. Yeah, really good news about that Men's Health Network. Be good to see, because one of the big issues for the BME Hub at the moment is mental health within the BME community, and obviously with the obvious statistics that we know, the high representation of BME people presenting in crisis. You know, what are we doing in the interim? So I was at a meeting yesterday with the Leeds and York NHS Partnership Foundation Trust, and they're looking at their inequalities within mental health funds. They're employing 2 workers, and being part of that steering group to look at how they can ensure that those workers are effective within the communities that need it, because there's a massive gap in the interim period of when people from Black and minority communities present with mental health and when they access services, and it's the gap needs to be fixed. So that's something, and one of the issues as well is obviously stigma, and that's one of the things it's not talked about as freely within certain Black and minority communities, and that's something that needs to change as well. So that's a big discussion point. Then we're looking at, obviously we're involved in various different steering committees that are looking at that as well, so that's something that's a positive. Also the Hub is very involved with the Black Lives Matter core group that the council have set up with the 7 work streams. So now we've got reps who are representing on several of those work streams now, and as those groups are starting up, they're going to be action focus groups looking at 7 key areas where systemic racism is embedded in systems that needs to be unpicked, really. So that's another area. And we're also looking at education, because with schools going back at the moment, a lot of parents are very sceptical. As Anne was saying earlier, parents are, you know, particularly parents within BME communities, are very skeptical about sending their children back to school because they are in that vulnerable group. So, and obviously with a lot of families being multi-layered, so with older people living in the same household as younger people, that's a worry for a lot of people. But going back to school, I think is and going back to work as well. Sort of going, it's a bit of a worry for people. So I don't know how that's going to pan out, but we'll keep an eye on things and see how things go. I'm also involved with the Phoenix Fund. I don't know if some of you are aware of the Phoenix Fund that the Lottery and the Children's Global Fund for Children have developed, that's aimed at it's an emergency fund for Black and minority ethnic led communities that are struggling at the moment and that are in a difficult position to get funding usually. So I'm on the panel for that. We're selecting, actually this week we'll be selecting people who will be getting some of that fund. So it's positive in terms of more smaller organisations who are doing work on the ground, who often get left out, will get pots of money that will help them to survive throughout this crisis, which is positive. So that's just some of the things.
That's brilliant, Annette. Loads of brilliant things there. It would be really good to get some more information about that core hub, that core group meeting and the 7 strands. Really important, that work around Black Lives Matter. And I note your change of language. I think we're trying to get away, aren't we, from reducing that to just initials and talking about people from Black and Asian communities and diverse communities. So really important. Thank you so much. Bit conscious of time, so we'll move on, but yeah, again, brilliant stuff. Bev, would you like to go next? Hi, welcome.
Thanks. Sorry, I'm not used to Zoom. Unfortunately, the council have not that advanced yet to get to Zoom, so I've just put my camera on. So I have to do it on my phone, so sorry. Yes, my name's Beverly Yearwood, and I'm community coordinator for Counter Extremism for Leeds, and we're obviously it's a post funded by the Home Office, but obviously I've worked for the council for just short of 30 years, and some people might have known me from community safety issues from working there before. So I think at the moment the key issue which we're monitoring in Leeds is really about the recent upsurge in anti-immigration rhetoric, particularly targeting hotels nationally. So that, and it's primarily at the moment being conducted by Britain First and Paul Golding and his sort of associates, but it really is sort of picking up nationally where you've got people attending hotels. There's been assaults on hotel staff, there's been sort of verbal abuse, there's been people spitting at people. So it is something that we're sort of trying to monitor closely because of the sort of crisis around there've been no centres space left in the relocation centres. So that's something that we're looking at in Leeds at the moment. We did have one hotel in Leeds, which now that has expanded, and we're just trying to manage the tensions in terms of sort of mainly the sort of online comments. So I think sort of if there's things that do come across your social media that you think that sort of, you know, borders onto committing hate crimes, then please use the intelligence portal to report that. So because we know that already since the recent new arrivals in Leeds, we've seen an increase in sort of really horrible things really online. So and the other piece of work that I've been involved with recently is just a 4-week sort of short task and finish group around young persons comms, particularly around August summer holidays. So we've now pulled a presentation together which shows what the outcomes for that. So I'll share that so you can send that out with and obviously with Voluntary Action Leads, because I missed the meeting because I was on leave.
Thank you. Really helpful to raise that kind of hate crime issue, which is something that we have touched on and is the kind of flip side, isn't it, to a lot of the kind of positive messages that we have.
One of the things that we do want to do is we want to start doing a lot more sort of awareness raising around the far right. So at the moment we're putting some briefings together. So that's something that obviously we want to do, particularly around the third sector as well, to raise the profile. Because to some degree, there's that balance between freedom of speech and hate crime, but to some degree I think some of the comments get normalised. Yeah. You know, obviously not extreme far right, but in terms of far right, people do operate with their views within the law. So I think we just need to sort of do a little bit more awareness raising really in Leeds around that issue.
Thank you so much, Bev. So Emily, and then should we go Simon, Anna and Carl? Emily next.
Thanks. Emily from Women's Lives Leeds, coordinating the movement for Leeds to become the first UK women-friendly city. My normal little spiel. The first thing is, like, there is definitely a worry that Leeds has become a concerning area amongst our community. And there's, I think, like Carrie said, lots of increase in isolation as people are choosing to sort of step back, stay in a lot more. And whether or not sort of things are geared up for that, because they obviously were when lots of people were properly shielding, but now people are choosing to, because they're worried whether services and are sort of responding to that, I suppose. Schools returning is a major concern. Mental health and wellbeing concerns around just kids as well, like kind of like getting used to that again. And there's a sense of like, oh, it'll all get shut down again, although lots of people are also saying they'll never shut it down. But, you know, just on a personal level, my son goes to Round A. They've shut year 9 down. There was a case in year 9, and so they've all gone back home again. So there is kind of feelings of like what's going on, what's happening. The rule of 6, confusions around that. However, what I would say is that the messaging is coming through that local messages are much better than national messages. So that's a pat on the back for you know, Leeds and stuff, but that's why those local messages are so vital, because they are much better than national ones. Also, people coming to terms with, again, something Carrie said, people coming to terms with things, you know, for longer term are unlikely to change. And I think we've shifted from thinking, well, we'll just get through this. It will just be this amount of time and we'll get through it. And now people are starting to realize actually it's a lot more long term than we think it is. And there's like new anxieties and worries around that, I think. In terms of our COVID-19 Women's Survey, one of the key things that we're doing, just to let you know, is to share key messages on social media around that. So I'd really ask everyone to support us to retweet all those and get at the constant, you know, the messages out about the disproportionate effects on women, because they are very different to there are also disproportionate effects on men, like Damien was talking about, but they're very different. So we need both those messages to come out. And we're doing some women's wellbeing packs. We've got some Leeds inspired funding. We're working on those with Space too. And the idea of that is to reduce isolation, say that we hear women when they say they've been juggling multiple roles and finding things very difficult, and, you know, thanking them for doing that. So that's just some of the things. I'm going quick because I know we're short of time, so I'll let the next person go. Thank you.
Thank you. You remind me, I should have thanked you for your brilliant chairing last week. So I'll pass to Simon and then Carl and then Owen. I've not forgotten as well. Simon.
Yes, hi everyone. Simon Phillips from Leeds Jewish Housing Association, but also on behalf of the faith sector. So I think what continues to be a challenge is contingencies around major festivals. Obviously this weekend is the Jewish New Year. Really impressed with the fact the government have actually produced a standalone guidance document, an internet page as well, specifically around safety around the high holy days. That still causes somewhat of a challenge, particularly where I'm working, where we have sheltered housing residents, where we're sort of varying from yes to no in terms of organising a communal blowing of the shofar, which is the ram's horn. Even if people are on their balconies or by their patio doors, you know, does it still constitute a gathering? What if people gather outside? So not sure if that's happening. In terms of other things, Leeds Faith Forum have pretty much finished their strategic plan, which does make reference to, amongst other things, COVID and public health. More than happy to circulate that once it's all finished. We did have some consultation from Leeds City Council's communities team, Religion or Belief Hub, but I certainly will be happy to share it with everybody else. Continued ongoing support from the faith sector in terms of, you know, food banks. This has been going on obviously since lockdown, really, in terms of all the great work that's been taking place. there was an event last night which was organised by the interfaith organisation Faith Action, which was all to do with the link between community cohesion and what faith communities have been doing and any gaps. The final thing is just picking up on what Damien said about Men's Health Network. I'd be really, really interested to connect with you, Damien, in terms of how men from faith communities can work with you. Because obviously, yeah, there's a crossover with BME groups, but there's obviously specific work that I think could be done in terms of men from faith communities. I've been doing some work in terms of men standing up against domestic violence and abuse. So perhaps that could be weaved in as well.
Yeah, please, yeah, pick that up around, yeah. And I think if we're going to trying to stop using BAME completely, I think. So I'm going to challenge you on that, Simon, because I think part of what we all need to do is just think about that language as part of the shift. But yeah, thank you so much. Carl, I'll come to you next.
Thanks, Pip. Yeah, so I'm just going to give you a very brief. Yeah, so just for those who don't know me, Carl Whitty, I work at Forum Central and supporting the development of the local care partnerships. So from a local care partnership perspective, the focus is on the winter planning workshops, which are starting next week and running across the end of September and October. So they're to bring together people from across the health and care system to share winter plans and ensure that no communities fall through any gaps. So we're going to be bringing a lot of learning from this forum, from the third sector during the pandemic, and hopefully transfer some of that learning to winter planning. Another thing that's going on within Forum Central and linked to some of the conversations within this forum is the digital inclusion events that are taking place as part of Leeds Digital Festival and Digital Leaders Week. So we've got an event coming up on the 29th of September looking at the third sector response to COVID-19 and showcasing the dynamism and amazing stuff that has gone on in the third sector over the past few months. So I think Daisy shared that in the recent briefing. I'd encourage everybody to sign up to that. Another conversation that we've been having with active leads is around opening up physical spaces. So we're in the early stages of conversations, but we're hoping to put on a few workshops to support third sector organisations to become more present in physical spaces and adjust their offer to the kind of, yeah, the needs of people who prefer physical spaces for support. So yeah, I'll keep you updated on that as that develops. And that's
brilliant. Thank you. Owen.
Hiya. So we have a meeting which is a kind of providers forum in Leeds, and quite a lot of stuff came from that. So that's mainly organisations that have supported living settings. They were having loads of issues about getting things right and not having enough guidance, specifically around risk assessments, and kind of like the provision there is kind of really different. Some people kind of going, oh, we can't do anything. Other people saying, well, we're kind of nearly back to normal, and not having that information. Unsurprisingly, testing is an issue in those settings as well. Again, like, you know, unsurprisingly, loads of confused messaging around that is causing a lot of issues within there, and maybe the message isn't quite getting through, although I do send on the updates about testing centres and who's eligible and that kind of thing. We're seeing like this strain on adult social care and social workers having quite a big knock-on effect in terms of kind of some mental health referrals that haven't been followed up properly, and educational opportunities not quite kind of coming together in transition teams. And then a lot of people have have kind of asked for funding for outreach support, so kind of people taking them out places, and there's a massive backlog there that's kind of obviously having an effect because there's a lot of strain on families, and you know, they've reached out, but getting that sorted is very difficult. Again, we're trying to start face-to-face work in October. There's various things standing in the way of that, but it'd be really good to know where there's specific guidance, and I guess that might tie into what you were saying, Carl, around opening up physical spaces, opening up community settings, you know, and what the best practice is, but B, what we're meant to be doing under the law, you know, and the rule of six and everything like that. Conspiracy theories have been quite a strong theme this week, both from staff from other organisations and from clients themselves. And that really feels like, you know, like it's undermining the message, and it's definitely more of an issue. I've been asked by Wendy just now to update you on some kind of AdvaNet-wide things. So Leap One, who are part of AdvaNet, who have lots of learning disabilities and potentially autism as well, have got a good amount of money to kind of increase the digital inclusion fund and train people up with that, which is really positive. And that's all from me for now. You're on mute.
Yeah. Thank you so much, Owen. And yeah, lots of important themes and connections there too. Anna from Health Watch, would you like to go next? And
she's not here, Pip, actually.
Is she not here? Sorry,
yeah.
Brilliant.
Yeah.
So if it's okay, we'll just take a few minutes now just to listen to a poem. So I'm going to hand over to Daisy and Carl.
Yeah, I'm going to attempt to share my screen and share my audio, so just give me a minute. Is there anything you wanted to say, Carl, or should I just go for it?
Yeah, just to give a bit of context, this is a poem which we commissioned a few weeks back, and Michelle Skelly-Clark, a local poet, has translated some of the earlier findings from the Communities of Interest work, so covering the lockdown period up to kind of mid-July area. And we recognise that there's so much valuable information that we collected over that period, which we're able to feed back to decision makers. But we also wanted to connect that information to people of Leeds and reflect it back and really kind of share the learning in a more accessible way. So yeah, we only just got this poem through yesterday. We don't want to kind of give any ask other than just to listen at this stage, and then we'll get back to you after this meeting and maybe request a little bit of constructive feedback.
Okay, here goes. If you can give me a thumbs up when you can see and hear it, that would be great.
Leeds, it's only when I'm not with you that your beauty glows. I can hold you in the centre of my palm, stealing hours of rewound memories, the album photo flicking movie in my head, city streets full of the heart of Leeds, the medley of diversity, my pride in this town, born and bred. Knowing with certainty that it is something different for you. We all look at Leeds and have different views. I ask you to come, try, fit yourself into another's shoes. Can you move like they do? How do we breathe in this pandemic when we're already surviving, continuing to exist in spite of accident, ordeal or difficult circumstances? And if we're all in this together, are we all in this together? What does that look like to me and you? It's a taste of panic you cannot hide from, tension in the families as everyone is in, whilst others are sat in silence. In the eye of the storm, some locked into a domestic war, unable to reach out, no phone, online access. How will you manage? Loss of sustainable contact, no more hugging, smiles hid under the masks we are wearing. And no one is asking how we're coping. We need clear and precise government messages for accessible communication, blanket restrictions. What fits one does not fit all. For open and honest conversations with police and parents and carers. For fears arise with confusion. Global word messages not providing solutions. World has stopped, still racism rising. Holding breath, people are dying. Leads on mute, a masked sensory panic. Surviving in these times of pandemic. Jobs lost, furloughed, independence imbalance, delayed payment tribunals, digital exclusion, feelings of being ignored and unsupported, of being lost, forgotten in the midst of pandemic, financial worries, life suspended, grandchildren separated from grandparents, losing precious days and lost play, the intergenerational bridge in the communities disrupted. Feelings of loneliness, depression and anxiety, fear of stigma and scapegoating, gender prejudice and hateful goading, ignorance and panic buying, and mistrust and a fear of scamming. And for others, a prison sentence, an incarceration, a punishment, an invisible virus, loss of mobility, a lack of direction. Extremely vulnerable people are still shielding. And until the vaccine is found, tomorrow feels like unsafe ground. What will happen post-lockdown? This is the liminal space between you and me. Inside of our four walls, the hearts of Leeds. So many grieving, holding it in to stop self from screaming, because people don't just hurt like you do, nor feel like you do, see like you do. Until voices are heard, they're not meant to. Empathy is in the hands of Leeds. Distributions through cities, magazines, wellbeing packs and child-friendly information, updating websites, arts practitioners are moving groups online, providing wellbeing time, healthy structures, healthy routines are building, responding well to digital challenges, accommodating and training new ways of thinking, creating online groups through regions and cities to share key information, Zoom, straight to your room, issues diffused in preparation for future face-to-face assessments, welfare and retraining, virtually there, virtual care, clear communication, compassion and resilience, positive partnerships, working together, really listening, grassroots groups responding to the needs of Leeds people, volunteers coming forward that would have never done this before, providing support with shopping, delivering hot and cold bespoke meals to the door, one step back and a smile of warmth. People with very little are making donations to feed, to share food parcels with others. This is the Leeds I hold in the centre of my palm, in the core of my sight. You see, behind the scenes, between the liminal spaces, we are communicating, sat at home creating new breathing spaces, making changes, organisations, community groups and members helping each other. This is the integrity of the Leeds people when we move together.
So we want to give you a bit of time and space to digest that. And we're going to be sharing the text after this meeting. We're really keen to hear your thoughts on it, particularly in regards to Kind of your thoughts from the perspective of the communities that you serve. We really want it to be as inclusive as possible. So yeah, I'll leave it with you to consider and digest, and if you could feedback, that'd be great.
Thanks. Thank you, Carl. So let's move now, while people are digesting and do use the comments for this, to Hannah, who incredibly timely. Obviously, all of the work and thinking that's happening around access to health has been a kind of real kind of theme through a lot of our meetings, but to have a specific conversation around access to GPs and some of the barriers that different groups that we're all working with are facing, and just to think as well about what we can do to improve this situation. So Hannah, I will hand over to you for the next 20 minutes.
Yeah, that'd be great. Thank you, Pip. Hello to everybody. I've met quite a few people, but some people I haven't met before. So hello to those that I don't know. Hopefully everyone's aware, and obviously Anna's part of this group. We're part of the steering group around the Communities of Interest Network as well. But Health Watch is all about hearing local people's experiences of health and care, particularly those with the greatest health inequalities. So that's why hopefully we've worked with you before, or you're aware of us, because all the work that we do at Health Watch is about amplifying the voice and the experiences of people in Leeds. But as I say, particularly those with the greatest health inequalities. And we've been doing lots of work in the city before COVID about how we do that together as a health and care system in Leeds. And so we chair a group called the People's Voices Group, which Voluntary Action Leeds and Forum Central are part of, which is around actually how do we work together. And our big message within the health and care system is that we want to see people's voices at the centre of health and care decision making. So that's sort of a very sort of brief overview of some of the work that we're doing all the time to put people's voices into health and care decision making, which is one of the reasons we're so excited and really supportive about the Communities of Interest Network in terms of having that really strategic group that can come together, and hopefully we can support and be part of that change of putting your voices straight into influencing what happens in Leeds in health and care. So really great to be here. During COVID, we absolutely wanted to work to make sure that people's voices were being heard. So I've been working closely with Forum Central and yourselves, but we've been producing a weekly check-in report, and some of the team might have been contacting you. You hopefully might have been sending it out to the communities that you work with, because what we wanted to make sure was that there was real-time experiences feeding into the decision making during COVID. And we've picked out particular themes. So we've asked people around mental health: are you getting the information you need around COVID? If you've got paused treatment, how is that going for you? Getting the right information from your health and care providers? How has it been the move to digital? And we've also done quite a lot of work around care homes and home people receiving support in home care situations as well. So out of that, so all the time we're wanting to hear people's experiences, and we influence in lots of different ways with that information. Anna's already talked to you, I think, around the information that we collectively put together around the move to digital services. So hopefully you'll have seen the report that we put together, which your views fed into, because Carl is part of that steering group. And so there's just two things that I'd particularly like to talk to you about. One is the digital work, and then, as Pip said, the other one is about understanding the communities that you work in, experiences at the moment of accessing GPs and primary care, as they call it. Just on the digital work, the report was the first bit of work that we wanted to do together. And for those that haven't read the report, it really highlights the fact that this huge, massive transformation of health and care services being delivered in a non-face-to-face way. has to, that there are barriers to certain communities being able to access care in that sort of way. And so the report really highlights that and makes a number of recommendations to the health and care system in Leeds, but also to individual organisations as well, to have a digital inclusion strategy. And then also it has recommendations for us as a People's Voices group about how we can support that as well and support people on their journey. So the report was the first step, but the second step is we want to do a year-long listening campaign to understand everybody's experiences of the move to digital. So we want to know how carers are finding that move to digital. We want to know how people from the deaf community are finding that move to digital. We want to know how refugees and asylum seekers are finding it. And so we'd particularly like to work with yourself, and I know that we've got a standing item on this agenda to gather people's experiences, but I'd be really interested, and it might be a conversation that we get in contact with you individually about, to say, how do we hear your community's voices over this coming year about the move to non-face-to-face health and care services? And we could do that in whatever way you think would be, good to do. Whether or not some of your, you think doing a video diary from somebody within your community might be good, or we could call you on a quarterly basis and get an update from you. Whichever way you and your communities would find it useful, we want to highlight those experiences of decision makers, because what we know with digital, it's just absolutely important that we get it right for all communities. And the idea is that we are going to produce a quarterly briefing that will be going across health and care decision makers, highlighting how it really is for people. And I know we had some really interesting insight yesterday from Caris at our Inclusion for All hub around that, but what we absolutely want to be hearing and highlighting good practice as well as the gaps as well. So any way that we can work with you and your communities about the best way that we can put in that intelligence, that would be great. So I've got 20 minutes, so I will just pause there on the digital and just see if anyone's got any questions and or any thoughts on that. No? So that's an ongoing offer, and actually we will be in contact with you separately about how best we can hear that voice. The second bit is around a piece of work which we're hearing, which is linked to the digital work, but we've been having conversations with the clinical commissioning group. GPs are sort of saying that actually there should be no issues with people accessing GP appointments at the moment. They're telling the clinical commissioning group that services are back out there, people should be able to access services. So we're really interested in doing a piece of work on that, because some of the intelligence that we hear is that there are issues and there are barriers to people getting GP appointments. So we'll be doing a general sort of population around what people's experiences are. But it would be good to hear from yourselves about the communities that you work with and any particular issues at the moment that your communities are facing accessing GP. Or it might be that you say, actually, the move to digital and the way that GPs are changing services is working really well for my communities as well. And again, it'd be good to feed that back. I don't know if anybody would like to sort of give any insight in the first, go first, or Owen, did you have your hand up there?
Yep, yeah. I mean, one of the issues that's come up in the autistic population and people we speak to is about the reasonable adjustments. So I think the biggest one is being able to go and see a GP face-to-face for various reasons around processing information and that kind of thing. But it'd be good to, and we had to make it very clear and advocate for that, help advocate for that person that actually that was something they had to do. But it'd be a good idea to put together some clear guidance for GPs to say, these are the really common reasonable adjustments, this is what you should be doing. Because it might be that they're kind of saying no to people and then going, well, and they had a telephone appointment, but that didn't help. you know, so they're still meeting a need in a way, but it's not actually working for people. That's my thought on it.
Yeah, no, that's really useful. Thank you, Owen. Yeah, yeah, because I think that's probably what some of the GPs are saying, that you know, people's needs have been met. They've had a phone appointment, but there's no measure at the moment to measure the effectiveness of those interventions being done by a phone or by video. It'd be really good if we can contact you after, Owen, just to link in with yourselves around that. That would be good. Just to say, we've also been doing a piece of work for the past 10 months, which has focused on the Accessible Information Standard, and because of what we knew that actually GPs were saying to the CCG that they were doing everything they should be doing with the Accessible Information Standard. But we did a report last year which identified that actually for the sight loss and sense deaf communities, that they weren't meeting the requirements. People had never been asked about Accessible Information Standard. People were still receiving letters from the hospital when they were blind. And we heard that yesterday at the meeting that we had at the Inclusion for All meeting. And within that piece of work, there's so much to go at in terms of making services accessible to all communities. But we felt 10 months ago that we just have to focus on those that are covered by the Accessible Information Standard, which was people with learning disabilities and physical and sensory impairment community. But yesterday we talked about widening that to also include, you know, RGPs offering the right language translation services to people, you know, so particularly for refugees and asylum seekers. So I suppose I just to let you make people aware of that wider piece of work that we're doing around access as well. But yeah, Owen, if we can be in touch with you, because I think that's that's just a really first concrete example. Really good, thank you.
Yes.
Annette, sorry, Annette, did you have your hand up?
Yeah, I just wanted to just add a bit onto what Owen was just saying there, because my brother is deaf and has autism as well. And my mum cares for him. My mum is 80 and has to do that liaison with the GP on his behalf, and my mum finds it very difficult to manage the IT sort of stuff. So I think there's an issue there for some family carers, particularly older carers.
Yeah, no, definitely. I'm just scribbling whilst we're talking as well. Thanks, Annette. Yeah, I mean, I think carers as well. We had a quick. Obviously, we're working with carers leads all the time as well. But you know, Val also highlighted the fact that having to call at 8 a.m. for an appointment doesn't work for a lot of carers, because people are caring at that time, and you can't hang on the phone for 45 minutes or whatever it might be to sort of try and get a phone appointment. But yeah, no, that's yeah. I've noted that, Anna and Annette. Thank you, Carius.
I think one of the biggest challenges that we see is, particularly in the GP practices, is there's such a big disparity. So you've got some examples of really good practice, and you've got other examples of not so good practice. And I think that's one of the challenges we've seen with the video conferencing, for example. This came up very early on, where certain GP practices really understood their video system and were very keen that they, particularly when using a BSL interpreter, would have a three-way conversation so that they could actually see the individual that was the patient and use the translation service of the BSL interpreter. We've got a lot of other situations where the knowledge is either not explored, or whereby they would rather ring and say, "Can you tell the person this?" And actually, for me, that's quite a big thing, because actually the patient should be being seen by the GP, not utilising our services as a kind of go-between. So, I mean, we have seen both sides of it, and I know I shared some of the more positive stuff on Monday, and I think there is a lot of positive engagement there to kind of share. You know, we've got, as I mentioned earlier, some of the community who want to be seen face-to-face. And actually we have had GP practices accommodate that, where usually they would prefer a video because that's what the patient has wanted. So there's been examples of both, I think. I think the challenge that you mentioned about accessing via telephone is definitely one that we experience. We get a lot of community members contacting us directly to say, I need a GP appointment, or can you help me? I've got a letter and I need you to organise that appointment for me. But for us then, our administrator then has to sit on call for that on the day appointment, and that is a challenge. And I know it's something that happens across a lot of the practices. And also, I suppose one of the solutions to that could be a text service, but it's got to be manned. So I think that's definitely something worth looking at, because if we get, 5 people from 5 different GPs and we're having to, how do we work that? It's quite a challenge. And we're providing that BSL interpreting service. So yeah, that's, I think, one of the points that is worth looking at. And then, of course, there are people that actually just aren't comfortable with the technology. And like Annette said, it's not feasible for people to join using video calls, etc. So those people, I think, have missed an opportunity, particularly during sort of March, April time. Our service dropped really low in terms of appointments. There was a lot of access, just wasn't available.
Yeah, no, thank you, Caris. Yeah, and I think another message we're hearing as well is that sometimes there are so many challenges for people. People are not bothering trying to access GP services, which again is a big worry in terms of people getting the right support at the right time, isn't it? Is there anybody else from any other sort of communities that will? Jane, have you got your hands up? Or yeah, Jane.
Hi, I just really want to follow on from what other people are saying about the difficulties people are facing with GP services. I have 3 autistic kids within our family, and one that's ADHD, and I mean, they just wouldn't understand, and like the youngest doesn't have any speech, and without seeing someone face to face and trying to explain that to a receptionist who wants to know the full details, which every time when you're ringing up, and then, I mean, because the system has changed where I am now as well. So if you want your regular medication, your pharmacy doesn't reorder it so you have to put in a request digitally, and not all your medication comes up, which then means that you've got to ask for a telephone appointment, and they're going, oh no, we're not doing it, you can do an e-consult. So you're writing everything in an email, you're not really sure whether it's safe, whether it's secure, and then you're just getting a text message back saying, oh yeah, I've done that for you. Whereas, I mean, I'm taking 28 different medications a day, and over since March, since the COVID, since I've come back from working in Wales, it's just been an absolute nightmare. I've not 1 month have I received the right medication, and in Dorset box for a blind person. I've had to upgrade my hearing aids to do the technology that we have for Zoom and things like that, so I can connect with Bluetooth. And that is, for some people, isn't possible, because those type of hearing aids are costly and people just can't do this. I mean, I've got a grandmother, she's 90, she's got dementia, and my uncle is caring for her, so he's actually had to give up his job after being furloughed, and then he's just said, look, I can't do the job because she's starting to wonder, unless she sees a doctor face to face, she has panic attacks. And I think the older community aren't gonna like my grandmother from 90 odd or 80 odd are not gonna want to be on the internet or have internet, and because they just won't get it. And
Yeah.
I think that's been the big thing, and I find that also in the deaf and blind communities, where there is a big range of elderly people that are deaf and blind, and they just the communications online is so limited, and then they go back to not actually caring for themselves.
Yeah, no, that's great. Thank you very much, Jane. How much longer have I got, Pip?
1 minute because we've got a quick update from Rajesh and some other updates. I'm so sorry, but I know Emily and Owen are wanting to come in. So
I'll type it in the text chat because I'm going to have to go soon.
I can be really speedy. Women's access to screenings and stuff like that. There was a lot of reports from our survey that said that they weren't having their things like cervical screening and breast screening, partly because of there weren't appointments available, and also because of lack of confidence.
Yeah. Okay. Thank you very much. Yeah. I didn't ask Pip. Are we recording this? Oh yeah, I can see we're recording.
Yeah, we are indeed, and we'll have notes. I don't know if Gina, because obviously this is very much your world. If you just wanted to make a final comment before we move on to some of the other updates.
Yeah. It's really complex, isn't it? I've been involved, Hannah, with some national work in the National Advisory Group about access into general practice, particularly for marginalised groups. My work particularly was around refugees, asylum seekers and the homeless. And the barriers are terrific. As you know, Jane pointed out, being asked at the reception lots of details when really it isn't actually necessary. In our particular work, how we work, Hannah and Jane, is that we don't call our receptionists, they're much more than that. We call them healthcare coordinators, because actually not everybody needs an appointment to see a doctor. You might need somebody else within that team, another healthcare professional or somebody outside a GP to actually help with your problem. Like you, Jane, you know, talking about the clinical pharmacist in the practice could have sorted all that out for you electronically, online, spoken to the pharmacy, sorted it, you know, without bothering a GP. And in terms of access, you know, for women's health, cervical screening, that shouldn't have stopped. There is no reason, if you have COVID measures in place, that should stop. We've been out on the street doing what we're doing, obviously with masks and gloves and being mindful to protect ourselves and the patients. So it's about attitude, and I think a big thing that's missing here, Hannah, from mainstream general practice is culture as well. They need to change the culture. You don't always need to see a doctor. There are other multidisciplinary teams within general practice now that are far more skilled. The doctors are great and the nurses, I'm a nurse myself, but there are other members of the teams, social prescribers, care navigators, mental health workers, support workers that can actually help you with what you need. So I think it's a wider picture. It's saying to the community what's available out there, and also changing that culture of general practice.
Yeah, great. Thank you very much. Pip, can I just say, in terms of next steps, it's a sort of an ongoing piece of work for us at the moment. So again, we might be in contact with you sort of individually, just with the set of really simple questions to make sure that we've got the voice of your communities into that piece of work. But thank you very much.
Yeah, huge thanks, Hannah, for bringing this important issue, everyone for contributing. But Gina, really interesting to kind of raise that aspiration about kind of, we should be doing so much better with some of this, shouldn't we? It's not just about it being good enough. And, you know, some of these are just basic legal things that should just be there. So how do we really kind of push that aspiration around people's health and well-being, which is so critical? So huge thanks. Rajesh, welcome. I know you'd put in the chat that you were joining us late, but we're delighted that you are here. We did have an update from Anne from Young Lives Leeds at the start of the meeting, and quite a bit of discussion around issues around young people, but it would be great to kind of hear what you've been up to, and hopefully from Anna from Healthwatch as well. I know she's incredibly busy. She's popping in and out because she's the only person covering her office. Rajesh.
Sure, yeah, thanks, Pip, and yeah, sorry again for joining late. I'll just give a quick update on where we're kind of at the minute with care leavers in Leeds, some of the issues and some of the things that are happening. So it's a really busy time for some of them. We're going back to things like school, college and uni. So we're in touch with a lot of them going through that right now, and it's a lot of differences to what they used to. So already we've had talks about sort of mental health support and things to get through some of the things like moving into halls and changing living situations. And some of the main ways that we're in touch with care leavers is through their personal advisors mainly, but we're also still using the Facebook page, the Clued Up page, which has been really good through the sort of pandemic. meeting in virtual groups like Care Leavers Council, Care Collective, all these different kind of social groups. And we're able to do some visits face to face through some activity centres like Herd Farm and Lynham Farm. And just having that offer has been really useful because they can take it up and go with their PA or someone they feel comfortable with, and it just gives them a sort of break, which has been really sort of refreshing for a lot of them. So that's all been going quite well. And we're trying to plan something in for the end of October, which is the National Care Leavers Week. Normally it's a really big event. It's sort of the event of the year for the group, and it's attended by a couple of hundred people, kind of in a fancy place in the city centre with like a big meal, loads of entertainment. So because we can't do that, that's definitely one of the big losses. And we know a lot of people really enjoyed that through the year. So we're trying to see what we can realistically do. And we're looking into things like the Carriage Works, which is a sort of COVID secure entertainment space still. And we're going to speak to them and see if we can do something. But if not, there's still the possibility it'll be like an online thing. But hopefully that's a way we can bring the big group together again. We're hoping to do that. What else? So one of the main kind of concerns at the minute is obviously, and this is obviously happening nationally, is that young people are driving the rise in cases, and what to do about that. So we're working with the comms team and we're speaking to sort of our Care Leavers Council to see if we can start developing some better messages to get out to young people, but also to understand how the messages would reach them better. So we're going to try and do some sort of videos and sort of see which social media platforms would be best for them to get those messages across. So that's just started, and I'm speaking to the group I work with later on about what they think would be the best way to go about that. But I think the concern at the minute is that, and I think they've already said this before, I think they'll say this again, is that young people do know the messages, they see it in lots of places, they understand it now, but it's more the fatigue with those messages, fatigue with lockdown. Yeah. And deciding that maybe it's not worth it anymore. And on top of that, it's the same as we had before with all of the kind of false news and misinformation that underplays the pandemic. So putting all that together, there's only so much a message can break through. We're still going to see what we think would be best, but there's a real concern there that it can only be so effective up to that point. And alongside that, we're noticing a lot less engagement with some of the social media that we do. I think a mix of going back to school and college and things, but also just fed up with all of the online kind of world and wanting to just get out and about more and see friends and etc. So that's where we're at the minute. Is that
brilliant? That's fantastic and really great to get some of those messages. I'll link you in separately. I'll pick up a conversation with you.
Great.
Yeah, about some of that. Anna, I know you're back. Do you want to put your update in chat, or do you want to just say a quick? It would be brilliant just to hear from you. So, thanks.
Hi everyone. Thanks very much, Pippa. I'm really sorry I've been kind of in and out of this meeting today.
Don't worry.
I know we're running out of time, so just a really quick update from me on behalf of a colleague. Some of you may have seen the How Does It Feel to Me videos. They've been used in all kinds of different places, and they've been used to give a voice. So far, they've been used to give a voice to people with long-term conditions and kind of depict their journey from their point of view through the health and care system over a series of months. We're now looking for new participants for this project, which is quite a high profile one in the city. And we're particularly interested in hearing from people who've had their treatment paused or affected in another way during lockdown, people who care for someone with multiple health conditions, people with mental health issues or their relative or carer. And we're also particularly interested in hearing from men and from people from BME, from Black and minority ethnic backgrounds. So I will put that round in an email to everyone via the weekly update that Daisy kindly sends around, so you can have more details, including the person to contact. But yeah, just a really quick one to say, please do look out for that. And also, you'll also be getting an email from me about the digital inclusion work very, very shortly. So yeah, just a couple of things. Thanks, everyone.
Fantastic, thank you as ever, Anna. Really brilliant. You know, the range of materials and the different perspective that you bring, and that sense of how we can work together, and that kind of stronger together is really powerful. Brilliant. What an amazing range of different perspectives and views, and just such brilliant work happening in different parts of the city that we've heard about today. So massive thank you to all of you. I know it takes a bit of time, but it just feels so valuable, doesn't it, to kind of hear people's different perspectives. Just some very quick updates, some overview. I mean, I don't think we need to dwell on the R rate. I think everybody's aware, you know, that things are significantly increasing in Leeds, but that everybody's working incredibly together and in partnership to try and address those things. We know that there's testing available. That's gone out in Daisy's update for key workers, including from the third sector, and really keen to keep stressing that parity of workers from the third sector having access to that. So really interested to hear from you. I think there's lots to say about lots of different things, but we'll make sure that we're keeping you up to date through the emails and making sure that that information's going out. Do let us have any themes that you'd like us to pick up in future meetings. Massive thanks to Emily, who chaired the last meeting, and Owen, who's very kindly agreed to chair the next one. And if anybody else is interested in chairing one of the future meetings, that would be great. Really good to get, you know, different people doing that and to share that. And finally, we've got some really exciting work happening around the outbreak plan, which we've updated on previously. So public health in Leeds, significantly investing in third sector in terms of some funding that will go directly to frontline organisations, but also working at how we build capacity and get those messages right. So that's the thing I'll pick up with you, Rajesh, in the shorter term, because we're particularly focusing around young people in our initial first week or two of that piece of work. So obviously, for, you know, again, reasons which everybody will understand, there's a real need to try and work with third sector organisations and other trusted community networks that are reaching young people to help understand how we make sure that we haven't got that sense of people turning off from messages, that we've got ownership and understanding of those messages. And we believe very strongly that the way to do that is to engage young people in creating the materials and making sure that they're very much at the heart of producing all of that. So we've got a proposal. We'll have an event starting from next week that young people and children's organisations are able to come to share some of the messages and understand, for organisations who've perhaps been less connected than yourselves in some of this work, what the situation is, what they can do to support it, how some funding will be accessible to them to help make that possible, particularly for small organisations, you know, who won't have the capacity necessarily to do this, but also for larger organisations who the sort of generous leadership and that sort of sense of almost training the trainer approach to sharing messages and building capacity through connections with small organisations is going to be really vital. So we are really kind of working on that. We're recruiting to a post to support that piece of work around the third sector outbreak plan. So I think that's everything. I'm sorry we've run very slightly over, but as ever, massive thanks to all.